My name's Heather Parsons, as it says. I'm a Public and Patient Involvement Officer with the Research Design Service. For those of you who know Megan Barlow-Pay, she will be my manager when she comes back from maternity leave. I love this job. I've only been in it since September, and it's a part-time role. In my career, I'm actually a school inspector, but my area of work is personal, social and health education, and so an absolutely crucial part of that work is pupil and parent voice, and understanding what it is that young people need to know about health literacy to make a difference to their lives, to now enable them to flourish and be healthy and achieve and attain. So in October last year, the Hampshire County Council came to me and said, would I do a specific piece of work for them with some secondary schools, looking at post-pandemic relationships within schools in particular and the impact they were having on health. And this came on the back of things like Everyone's Invited, the death of Sarah, sorry, I've forgotten her surname. Thank you, Sarah Everard, and a whole lot of issues about Black Lives Matter and all of those things where we were seeing prejudice, and we were seeing prejudice really called out. And schools were in a really difficult place because they thought they were doing okay. And suddenly all these things came out that said, actually, you're not. There's a lot of bullying going on that you don't pick up on. There's a lot of hurt and disruption going on that you don't pick up on. And that impacts on our physical and mental health. And that's what children were telling us. So it was really important, this piece of work. We gave schools the choice of how they wanted to work with me. So either I spoke to parents, I spoke to pupils, I spoke to teachers. But whatever I was doing, I was looking at health and well-being. One of the schools that I spoke to was a deputy head. He was really lovely from the first time I spoke to him. And he said, we've got this equality advocate group. So it was a whole mix, representatives from every year group who came together to look at equality issues across the school. And he said, and a subgroup of that is to do with sexuality, LGBTQ+. And he said, but I'm worried about them. He said, they've had such a bad experience that we hadn't necessarily anticipated, that he said, there's a feeling that they want to be activists. He said, and that won't go down well. That won't work in this situation. So I said, that's fine. Let's get together. Let's see how we can work together. So I went in, met them. This is just 3 of them. It was a group of 6 and then became 7. They were stunning. From the first day, they were just stunning. It was really interesting because I always model. If I ask people to say something about themselves, I always model it by saying something about myself first. And so I just said who I was, what I was doing, and why I was wanting to talk to them and understand what was going on. And then we went around the group. And they all introduced themselves, used it, and then shared their pronouns. So when it came back to me, I said, I'm really sorry, I didn't share my pronouns. Is that something you would want me to do? And they all said, yes. We don't like asking adults what their pronouns are because often we don't get a good reaction. So that was something I learned. And that was the start of a joint learning that went on throughout the whole time I worked with them. What was really interesting was we started just with a big piece of paper on the table and the power of the pen. I always take a pen for everybody, so nobody has the power. So they all had a pen. They could write, they could doodle while they were talking. It didn't matter. We just were trying to record what was happening. I very often actually physically record it as well, because the conversation will often elude to the greater issues that are going on. So that's how we started. And they would start to say things about, well, we really want this to happen, but nothing's going on. And this deputy head, who was part of the group, kept jumping in and saying, but we're doing, and so in the end, you might see here, in the middle of the table, this is Rosie. Rosie popped out of my bag. I have a whole collection of talking tools. This is Dr. Ted, who is wearing my pronoun badge, although I was a bit upset that it was so sexist in its colouring. Anything tactile and holdable I use as a talking item. If it's a new group or a group I don't know, I have two, and I keep one as the facilitator and pass the other one round. So the rule was that you couldn't talk unless you had Rosie. Rosie is now living at the school. I haven't seen her in a long time. And it was to stop the teacher keep interrupting. Luckily, he was fabulous, and he understood why I did it. Sometimes you have to negotiate a bit more around that. But what happened then was they shared all of this stuff about what had happened to them, their experiences. One of the young people had been born female and was now male, presenting as male, and had had lots of abuse, lots of issues around changing rooms, toilets, all of those sorts of things. And we just allowed it to unfold. And we allowed the hurt to unfold. And we gave them space, safe space, and time to do that. One of the things about making the space safe is about developing a group contract. And I really apologise if these things are things that you already do, but I'm just trying to explain how we've tried to do it well with this group. So this is a different group's rules, but these were the things they wanted. Enjoy, have fun, listen to other people's ideas, etc., etc. So once we've come up with those things, we then come to this, which is, if these are the rights that you want in this group, what are our responsibilities? So what are the students' responsibilities, and what's my responsibility as the facilitator to make sure that these rights happen? And this is the bit that very often doesn't happen in developing group working agreements. And this is the bit that makes action. And so then every week when we came back together with this group, the LGBT group, this was theirs. This was their this was their rules, which I prettied up because my writing's not very pretty. And there were important things on there for them. Make sure you are being COVID smart. One of the young people had a vulnerable parent. So, really? So we agreed that we would wear masks. We would agree that we would check it out if the rules changed, or that we would ventilate the room differently, or we would get a bigger room. So we thought about the individuals. We also talked about confidentiality, and the deputy head was also the safeguarding lead for the school. So we explained what had to happen, but we explained how it would happen in this group. We also explained about people having space, and the youngsters said they wanted to be able to leave the room if they were upset, but they wanted one of their friends to come after them, not me or the teacher. So that became part of our rights and responsibilities. What happened was they unfolded all of this need, and we said, okay, so what can we do about it? What would make this better? And they said, well, we need to know why people dead name us. I don't know if you understand dead naming. I didn't until I met them. So if you have chosen to present with a different gender to the one that you were born with, then if someone calls you by the previous name, that's called dead naming. So we worked together with a researcher. We put together some surveys that we could send out to the adults, because we thought the adults might not be kind in their responses, and we needed a protection mechanism for that information coming back. So these kids worked with the researcher, built a great set of questions, sent them out. They actually did one-to-ones with representatives from every year group. So almost like qualitative interviews with each, I'm going fast, with each of year group. And what they've done since then is they've started to understand that people don't understand the terminology, they don't understand about pronouns, they don't understand about dead naming, and they've come up with their own training programme for teachers, parents, and they're inputting into PSHE lessons so that those lessons can include those elements. So I'm not a researcher, but we kind of trained them to be researchers. If I had one thing that I'd want to say to you, this is the takeaway message. And you're lucky because I've had to practice this so I don't sing it to you. But definitely, talk less. Don't just listen here, and smile. Let them know that you really care about those things that matter to them, even if you don't understand them, because the more you listen, the more you'll understand.